Hi everyone, so today I'm going to talk to you about complex trauma or complex post-traumatic stress disorder. Complex PTSD is a condition that involves many of the same symptoms of PTSD along with some other symptoms. So initially we first recognized PTSD as a condition that primarily affects war veterans, but over time we have come to understand it as something that can be caused by a number of traumatic events such as car accidents, natural disasters, near-death experiences, or other isolated acts of violence or abuse. When the underlying trauma is repeated and ongoing, some mental health professionals make a distinction between PTSD and complex PTSD. Okay, so both PTSD and complex PTSD result from the experience of something deeply traumatic, and so it can cause symptoms like flashbacks, nightmares, insomnia, hypervigilance, depression, anxiety. Both conditions can also make you feel intensely afraid and unsafe, even though the danger has passed. However, despite these similarities, there are characteristics that differentiate complex PTSD from PTSD, according to some experts. So the main difference between the two disorders is the frequency of the trauma. PTSD is caused by a single traumatic event or acute trauma. Complex PTSD is caused by long-lasting trauma that continues or repeats for months, even years, and there might be so there are multiple incidents of trauma over a long period of time, and there might be many different kinds of trauma. Okay, so that is the distinction between the two. The psychological and developmental impacts of complex trauma early in life are often more severe than a single traumatic experience like acute trauma. So it's so different that many experts believe PTSD diagnosis doesn't adequately describe the wide-ranging, long-lasting consequences that come with complex PTSD. So what are some symptoms? So in addition to all the symptoms of the core symptoms of PTSD, like re-experiencing, avoidance, and hyperarousal, complex PTSD symptoms generally also include difficulty controlling your emotions. So there is emotional dysregulation and a lot of difficulty controlling those emotions. So it's very common for someone who is struggling with complex PTSD to just completely lose control over their emotions, which can look like explosive anger, persistent sadness, depression, suicidal ideation, that sort of thing. They can have a very negative self-view. So complex PTSD can sometimes cause a person to perceive themselves in a very negative light. They may feel very helpless, guilty, or ashamed. So there's a huge sense of shame and guilt. And they often have this sense of being completely different from other people, or so there is this inherent sense that I'm different, or I'm broken, or I don't belong. Okay. They also have this difficulty with relationships. So relationships may suffer due to difficulties trusting others and a negative view of themselves. So a person with complex PTSD might avoid relationships or develop unhealthy relationships because that is what they have known in their past, or that is what may have been modeled to them as children. So they might also have this detachment from trauma. So they might completely disconnect from themselves. That is called depersonalization. Or they might disconnect from the world around them. And that's called derealization. So some people might even forget their trauma. And so that at that point, it just becomes very suppressed and almost repressed. And there is this huge disconnect between what they experienced, the trauma they experienced, and their present life and the way they are sort of living. But you will see the effects of the trauma in the way they are dissociating or depersonalizing or derealizing. And then they might have a loss of a system of meaning. So this can include just losing your sense of core beliefs, values, religion, faith, or hope in the world or other people. So all of these symptoms can be life-altering and can cause significant impairment in someone's personal, family, social, educational, occupational, or other important areas of life. So what are the causes of complex PTSD? Complex PTSD is believed to be caused by severe repetitive abuse over a long period of time. So this abuse often occurs at vulnerable periods of times in someone's life, such as early childhood or adolescence, and it can create lifelong challenges and impacts. So this traumatic stress can have a number of effects on the brain. So research has shown that trauma is associated with lasting changes in key areas of the brain, including the amygdala, hippocampus, and the prefrontal cortex. So the types of long-term traumatic events that can cause complex PTSD are childhood abuse, neglect or abandonment, domestic violence, genocide campaigns, childhood soldiering, torture, slavery, that sort of thing. In these types of events, a victim is under the control of another person, and so they don't necessarily have the ability to easily escape. So what ends up happening is their fight or flight response is activated, and if they're unable to either fight or run away from that dangerous trauma or situation, they might go into hypoarousal, which is the freeze state. This is where you will see a lot more dissociation and disconnection and depersonalization or derealization. So treatment for complex PTSD includes or can include a combination of medication and psychotherapy. So research has shown that a combination of the two can be quite helpful. So it is recommended that you talk to someone you trust, you seek some support if you are struggling with some of these symptoms. There are so many different kinds of modalities out there that are trauma-informed, that have been found to be very helpful for trauma or complex PTSD. So, try talking to people, try talking to a therapist, a professional, and reading more about it, reading self-help material to figure out what would work for you. Okay. So, in terms of coping, the first step in treating complex PTSD does involve stabilization of your symptoms. So if there is suicidal ideation or intense emotional dysregulation, then the first step would be stabilizing some of those symptoms. And for that, you can start off by talking to a psychotherapist or a professional, and learning tools in terms of how to manage that, and starting to heal some of those deeper wounds. So you can try to find some supports, some social support networks, create a social support network. There might be groups that you would want to join, hopefully past this pandemic. But maybe there are some online virtual groups that you could join. You could create a supportive network of family and friends who are there for you when you are feeling overwhelmed, angry, anxious, or fearful. So in those moments, you could reach out to them and they could support you. You could also practice mindfulness. Mindfulness is an evidence-based modality that is found to be very helpful for trauma, for anxiety, depression. So you can, and for stress, so you can use mindfulness to help you become more aware of what you are feeling in the moment and combat those feelings of distress. It involves spending a little time every day focusing on the present moment. And then finally, you could also start off by just writing down your thoughts, start a journal. Research has found that writing in a journal can be very helpful in managing PTSD symptoms and decreasing symptoms of flashbacks, intrusive thoughts, and nightmares. So in terms of treatment, a journal can be a great way to start tracking your symptoms that you can maybe later discuss with your therapist. There are also apps that you could download to, start working on yourself, to start improving yourself, to start healing yourself. There are support groups, self-help books that can be helpful when you're dealing with complex PTSD symptoms. There's a really good book called The Body Keeps the Score by Bessel van der Kolk. So if you want, you could get started with that. So that is all for today, and I hope you found that helpful. And I hope you have a wonderful weekend.